Good afternoon here from Galkacyo General Hospital. I am Dr. Muhammed Hussein Aadan, the hospital director. I would like to share with you in this event that since March last year we had been a pandemic of coronavirus. This has affected the entire community in its different life walks. In particular, we had 3 waves. One which has been in the months of April, May in 2020. Then in the autumn of 2020 we had another wave. In all these 2 waves, we never have had any much casualties. And in this setting, I would like to share you by the end of February 2021. We have a new wave of coronavirus, which has high infectivity, and the entire community has suffered it. To give you an example, we made a sample of 350 people, and more than 50% of that sample for coronavirus were positive. During this period, our ER room has taken more than 2,000 people who came there for health checkup, and of these 176 had getting medical attention from our side. Within that 176, we made an admission of 76 people which were positive, and this quota of positive people who had been in the hospital, about 43 of them have died in the hospital. During this period, I would like to share with you, we had so many medical challenges, but the worst of all of that challenge was the lack of oxygen supplies. And this really has taken a high toll of death. We did our best. I would like to mention here the Galkacyo community, business community, has made a great effort for us. Though it was a bit late, it is intervention, but it saved so many lives, and they fundraised money for us, and now we are using oxygen supplies supported by them and provided by them. But that's not the solution. I wanted to urge and make a pledge to all who are listening or watching us, that this hospital, which has a capacity of 500 beds and lies in the central Somalia, treats almost all the patients who live in the Somali-speaking peninsula. Plus that, we also treat patients from our neighboring countries like Ethiopia, and in that perspective, we can claim to be an international hub. And as I'm speaking now, we did a temporary solution to get oxygen supplies fundraised by the local community business groups, but that's not the solution, and we are urging for this hospital to own, for the last, it is own medical oxygen plant. We deserve it. We treat, if I give you statistics, every week or every day we meet patients of more than 600 people, and every week more than 4,000, and roughly every month we treat 25,000 people who hail from every corner of Somali-speaking peninsula, plus the neighboring countries. So we deserve, it's not only for the COVID-19, but for all the other medical emergencies. We need really a persistent and continuous oxygen supply. So we are urging for the international community, everyone who is listening to us, friends, governments, individual philanthropists, to come up and fundraise for us to own our own oxygen supply. Our estimated initial budget for that oxygen supply is $120,000 US, plus it is contingency plan, which can go from 10,000 to 30,000. So that's the amount of money that plant will cost. I am speaking to all the friends, colleagues, anyone, individual persons, governments, NGOs, hospitals, why not? to fundraise for us and be part of that project. We would like to also share with you, we Galkacyo community, as we did already for the oxygen supply provision, using cylinders and oxygen concentrators, we would like also again to be part of that fundraising and make another contribution, ulterior contribution. So I hope this message and pledge for gas into your ears. And really, this is an emergency situation. We don't know when COVID-19 will go away, but it's projected that it will stay for the coming years. So we have to be prepared for it. And I assure you, this oxygen plant, if it's provided to this hospital, it will be used as we are treating patients from different parts of Somalia. It will be in use for that people as well, for their oxygen supplies. Thank you for listening, guys.